Hello, everyone. Welcome back to another episode of the R Squared podcast. My name is Rajat,
And it's your boy Rishman here. What's up?
and today we have a very special guest with us. We have Rinal Gudka, who is an osteopath based in
Hey.
Wales. Rinal, thanks for coming on. How are you doing?
I'm good, thank you. Thanks for having me on. I know we've been trying to get on for a while now, so finally we can get it done.
Yeah, you're so busy all the time. It's so hard to find dates for you. But
I think it's also the hosts here who are busy as well. So
no, but yeah, thanks for coming on. As I said, you're an osteopath. So, firstly, I want to get onto that profession because, to be very honest with you, I had not heard of osteopathy before I met you. And so, could you please expand on what is osteopathy?
okay, so I get this question quite a lot. You're not the only one who kind of doesn't know what it is. I think even when I decided to do it, not many people knew what I was getting into. But in simple terms, it's to do with like muscles and bones, helping people with pain, helping people with injuries, getting them onto rehab. But then recently, it's become more of prevention as well. So it goes from head to toe. You could come in with any kind of discomfort, and we try and identify why it's coming on. And then we have a set of treatment plans that we do, and then we do some rehab exercises as well. So, in a broad way to explain what osteopathy is just to do with muscles and bones and how to make sure your body is functioning quite well.
Okay, and then how does it differ from physiotherapy?
So again, that's another question we get asked. So there's three professions, not only physiotherapy, but there's chiropractors as well. So chiropractic, osteopathy, and physiotherapy, they're quite similar in different ways. Like the bottom line is the same. We want to get everyone better, but I think it varies in terms of techniques. So as osteopaths, we use a lot more hands-on manual work that we do on patients. And then physiotherapy generally focuses on a lot more rehab based side of things, whereas we incorporate both of that. We incorporate manual therapy, but also exercise based stuff. So there isn't that much of a difference. I think it's what works for each individual. For certain cases, it would be physiotherapy that's better than coming to see us.
Just from your side, like from your experiences, expertise, what are some of the you can just randomly say, cases you've dealt with, no names named, of course, but like with related to injuries and those areas.
Should I just talk about you two? Because you guys have also
Yeah,
uh,
I was just gonna say, we are some of the cases.
yeah, I mean,
Yeah, sure, by all means.
yes, like you two have called me numerous times or sent me pictures, like I've injured this, what can I do? So you two are some cases here, but it depends. Like cases can range from so many different things. Like the typical case we see is lower back pain. Like almost more than 80% of people, these are like figures you can find anywhere. More than 80% of people will experience lower back pain at some point in their life. Some experience it over and over again, and that's usually when they come to see us. So it could be, let's say, a 50-year-old man coming in complaining of back pain after plowing the snow last week that we had. But then it's not only that we have to look at, we have to look at their lifestyle. So they could have been in manual jobs beforehand, or they're not physically active, and then that could also be leading to some of the pain. So when you talk about a case, it's quite hard to narrow down exactly what we want to talk about, but um, that's what we'd look at: the age, what they came in with, why it's come on, how long they've had it for, and then we do our physical assessment to see where the pain is coming from.
Okay,
Is that
okay,
what you
and
wanted, or?
Rishi.
Sorry. Yeah, no, that was I was having a few flashbacks of my injuries, but that is very good explanations. Yeah, I
Yeah,
mean, lower back pain. To be fair, a lot of people have issues from it. Definitely.
yeah, and I mean, and also, so you on that you mentioned, for example, of the snow plowing, but is there a lot to do with sort of posture in terms of one in sitting and two in sleeping?
Yes, again, so more and more research is actually coming out recently to say there is no bad posture. Like, there's this umbrella term everyone uses, like bad posture, bad posture. But what makes it bad is how long you're in that position for. So that's what makes the position bad. So if you're sat down at a desk for like 3 hours and you haven't moved at all, that's what makes it bad. It's not really the slouching for 15 minutes a day that's making it bad. It's whatever you're going to do, you have to do it in short bursts and then you want to keep moving. So it's actually a phrase, new posture is good posture. What that means basically is the minute you move and you've changed your position, that makes your posture better for you.
Oh,
But
interesting, interesting.
yeah, so there's more and more research coming out to kind of debunk these old myths and quotes that people have been sharing over the years. But when it does come to sleeping, because you're static for such a long period of time, there are certain positions that are better. So, like, generally, they say side sleeping is better than sleeping on your front, and back sleeping is also quite good, but side sleeping is obviously better than that. But you want to have enough pillow support. So I know when we were in uni, we all use really soft pillows or whatever's cheap out there, but then realistically, that's not good for you. You want like an orthopedic memory foam pillow that's going to support your neck quite well. Usually they say from the bottom of your ear to the top of your shoulder, that's the gap that you want to fill with the pillow when you're sleeping on your side. And you want to put a pillow between your knees to support your lower back as well, so there's no twist in it. But then some people prefer to sleep on their backs, and then they say put a pillow underneath your knees to take the pressure off your back as well.
Oh, wait,
Oh,
when you're sleeping on your back, you just explain that more. Sorry.
So when you sleep on your back, they say to put a pillow underneath your knees, and that's to take the pressure off your lower back. So particularly if you're struggling in pain, you're just supporting your knees. Because when your legs are fully outstretched, they're under constant stretch. It's pulling onto your lower back as well. But the minute you support your knees, you take that pressure off.
So I've heard some people say that when they're sleeping on their back, they also put a pillow under their feet to have them raise for better blood flow. I don't know how that affects in your opinion.
So that can get tricky. Again, it's down to case by case. Yes, if their circulatory problems are more than their back problems, then I'd probably say raise your feet up. But then equally, if that's what's more comfortable for them, then that's fine as well, as long as they're not struggling with their back because they're putting their feet up on a pillow. I mean, myself, I'm a front sleeper, which is the worst. Considering I'm in this profession, it doesn't really help because that's what I try and tell people not to do, because then you're turning your head to breathe, so you end up with like neck pain. Um, so it is tricky, and sleeping overall is the most important things. How you sleep is okay, it's not that important, but yeah, if you're not getting good quality of sleep, your body's not healing, you're not going to concentrate, you're not focusing. So overall, sleep is more important, and then how the position comes in is after.
and then you mentioned about the pillow, but then does the mattress as well have an impact as well?
Mattresses do. So I actually found out recently there's some stores like in the UK that you can go and they adapt the mattress to your own. So you lie on it and they change the different levels and they adapt to what's suitable for your body. Um, Generally, any kind of memory foam mattress is good because it's more supportive. And they do say start changing your mattress after 6 to 8 years. So it is a generic guideline. If you start experiencing pain, you try and flip your mattress over, and then if it doesn't work, it's time to replace your mattress. That's how I look at it.
Ah, interesting.
Yeah,
Yeah.
it's nice. And so like I want to go into some of like other issues as well because you initially mentioned lower back, which I also assumed would be a pretty common theme across people. I would assume another common theme is knees or like knees, ankles, those sort of joints.
Yes, particularly in active people. So the reason I got into this was because of my own knees as well. Like I've had surgeries on both my knees when I was quite young. So when I was doing rehab for it, it was through an osteopath, and that's when I realized I could have avoided a surgery if I got the right care at the right time. So that was my motive behind studying osteopathy. If I can help people avoid surgeries, then that's what we wanted. So knees are particularly something I love treating because I can share my own experience into it as well. And over the last 2 years, I've been working a lot on my own knees to strengthen them. So you are right. Knees are a common condition, mainly from runners or athletes who've been playing sports and stuff. They get too excited and do a bit too much. I think you both are commonalities here.
Unfortunately, yes.
uh, or sometimes it's also not stretching on time. Like people just get into things, they don't stretch before, they don't stretch after. So your joints are not warmed up, and then that's how they end up with injuries. So if someone like that does come in, the idea is they need to take a bit of a rest from whatever sports they were doing or how they've caused that injury. And then we need to get them stretching, get the joint relaxed, less inflamed, and then you build the strength back up. So the idea is never to get people to permanently stop their activity. It's just in the short term whilst you get them to rehab it, and then you amp it up again.
Let me ask you regarding the strength part, because again, like, because we love fitness, as the main podcast theme is, with strengthening of the knees, what do you recommend generally? I mean, we are, health freaks. We love gymming and all sorts of sports and cardio. But from a medical point of view, to prevent now the injuries, what would you recommend? For strengthening of the knees, I would
Like,
just think a classic squat. Uh,
yeah, classic squats and stuff are good, but what you want to do is if you're new to rehab, like obviously you have the knowledge behind how to lift weights or how to squat with weights, but if you're new to it, you ideally want to start body weight stuff. So I generally do like the wall squat, so you're leaning against a wall, and I tell people when you're brushing your teeth in the morning, just do a squat as you're brushing, because that would take you a good 2 minutes, 3 minutes, and that's how you're incorporating body weight stuff. Squats are
That's
good.
sorry. That's first I've heard that. That's
Yeah,
interesting. I
same.
will. That's
Really?
interesting.
Yeah.
Yeah.
Really? We've got standing on one leg as well as you brush your teeth. That's to build your proprioception in the ankle and the foot. So if you've got unstable ankles, that would be the first thing we tell people. But yeah, brushing your teeth as you squat against the wall is a very common one in our industry, I'd say. Um, and then you'd slowly progress them onto weights. Squats, lunges, using machines at the gym, those are all good. But also focusing on single leg workouts is better than doing just the standard squatting and all. Because sometimes you don't know if there's an imbalance, there's a weakness on one side. So when you do single leg work, you are identifying these weaknesses and then having to work them a lot harder.
Sorry, just to interrupt one sec. Regarding what you said on imbalances, right? Because even I see that myself generally in the gym when using dumbbells. For example, my left side would be weaker than my right side, be it leg, hand, or shoulder,
Mm-hmm.
whichever part. But now I get a lot of different contradictory opinions from people, including bodybuilders, saying that just continue doing the same weights for both hands. But I don't understand, is should you be doing more reps, more repetitions for the weaker side, or are you continuing with the even balance pushing? So how do you determine and judge that?
So I would agree. You don't want to necessarily be doing like 12 kilos on one hand and 10 on the other just because it's weak. You don't increase your repetitions either. But what I'm trying to say is if you're doing it on, let's say, a barbell, your stronger side will take over. So you'll be able to progress in your weights, but your weaker side will probably never develop. So I would always say use two dumbbells and then do single arms, and then you'll do double arms together. So that's how I would progress on the weights. Does that make sense?
Interesting. Yeah, it does. Clear cut. Nice.
Obviously, if there's a very big difference in your weakness, then you need to probably get a medical professional or a health professional to look at it, because it might not just be a weakness, it might be an injury in there that we're looking at, or there could be something else that's affecting you to be able to lift.
Yes. So to all our listeners there, if anyone has any issues, kindly do message Rinal.
Yeah. Yeah. Yeah, because I want to go back a bit to the knee thing as well, because I learned the hard way how to take care of your knees. Because and one of the things you mentioned about not warming up is one thing I used to
Yeah.
do. I never warmed up, just used to immediately start running, and yeah, I learned the hard way not to do that. And so is the main, so like we talk of a knee problem, but biologically, what exactly is it? Is because at least for me personally, I think it was basically the cartilage essentially being eroded off. Is
Yeah.
that basically the main problem, or are there other that can
So
arise?
not always, because the knee joint it's made up of so many different structures. There's bones, there's ligaments, there's muscle connections, there's cartilage, like you said as well. So it could be anything that could happen. If you've injured it, so you've gone over or your knee's given way, then the likelihood is you've either injured a ligament or your cartilage in there as well. But sometimes it could just be straining of the muscle, so overuse of muscle. Sometimes the muscles don't grow at the same rate as your joints and body is growing, so you end up with this chronic tightness. So it could be a range of different conditions that can lead to knee pain. Obviously, as you grow older, then that changes into like arthritic wear and tear through the knee joints. So older category of people will come in with arthritic pain, whereas younger ones will come in with more injuries to the knee as well.
Okay, okay, great. And I also wanted to touch upon this, and you quickly mentioned it as well previously about how you got into osteopathy. So can you give a bit more detail onto why you chose to pursue this profession?
And
Yeah,
just to add one more question into that, any challenge that you face, just if you want to say, like, during your history of that.
challenges in studying it, or
So during, like, exactly to Roger's question, but any difficulties and challenges during that process.
okay. So again, it goes back to like I briefly mentioned. So I used to suffer with knee dislocations. Like I could be walking from the sofa to the door, and my knee would just dislocate. I think it happened over time. I used to do a lot of sports, so injuries, and I had to have two surgeries, one in each leg, within about 6 years difference. But when I was doing rehab for the second one, it was when I came across an osteopath who's now a really good friend of mine in Kenya. And talking to him and going through the rehab, I realized I could have avoided the second surgery if someone had told me about strengthening at the right time and how to get my knees functioning quite well. Um, so then I was thinking, okay, that could be an option for me. This is the same time when I had to start deciding what I wanted to study. I knew I wanted to go in the medical field, but I can't do surgeries and I can't, I don't like anything like that. So it was always physiotherapy or something along those lines. And then there's a group of osteopaths who come to Kenya every year and they volunteer for about 2 weeks where they go to rural areas and they just give free treatment to all these people who can't afford it. So I volunteered with them for 2 days just to get an idea of what osteopathy really is about. And I think that was probably my life changing moment. That's when I was like, okay, this is exactly what I want to do. One of the days they were treating children with cerebral palsy. So it's a neurological genetic condition. These kids couldn't actually speak or walk or anything, but when they were having treatment, they were laughing and they were smiling. And just seeing that on their faces, it showed a sign of relief from whatever they were suffering. And I think that's when I was like, okay, that's the position I want to be in. So that's how I chose osteopathy. But in Kenya, not many people knew what it was, including my own parents. Like when I had to tell them, oh, I'm going to study osteopathy, they were a bit like, what is that? And like I had to try and explain to them. I took them to visit the osteopath so they could understand what it was and what job prospects were as well. So that answers Rishi's question. The challenge I faced was not many people knew. In fact, when I went to one of the I don't know what they're called, but centers to apply to universities. They almost tried talking me out of it. They were like, oh no, this is not good. Like, why don't you consider physiotherapy? There are better universities for it. But in the end, yeah, I was like, no, I'm going to do osteopathy. So here I
I
am.
mean, massive credit. Good job, and massive credit. I mean, we're seeing the results and the people
Yeah,
you're helping, including me and Rajat here. Thank you
yeah,
very
yeah,
much.
Thank you.
definitely.
Thank you.
Yeah, and I guess just to carry on from that note, you went to Swansea University to
Yes.
study osteopathy,
Yes.
and then can you tell us a bit about, I guess, the stuff you did there? What does an osteopathy degree look like?
So it's a 4 years master's degree. Um, Ideally, it's a lot of studying. But then we also have a clinic on campus where you have to start doing clinical practice as you're studying because we have to get about 1,200 clinical hours before you graduate with the degree. Um, so I think during second and third year was a lot of clinical practice. It's a private clinic. Students generally are bigger clientele in that because it's a university clinic. I think it used to be about £25 a session, which was quite cheap for students. So if they have had any problems, that's who you'd see mainly. And then in your fourth year, we also worked with an NHS referral clinic. So that's when you start to see a lot more complicated cases. You're most of the time you're like the last resort for these patients because they've been through the system, they've had painkillers left, right, and center, they've had tests done, and nothing's helping their pain. That's when they come to see us. So over the 4 years, you get 1,200 clinical. You have to do 1,200 clinical hours, and you get a lot of practical experience. And then we do have to write a dissertation, like everyone else does as well. But I think I don't know. It was 20,000, but it got reduced to 10,000, which I don't know if it's bad or good because it's a lot harder to fit everything into a shorter word count. And I think when I graduated was COVID, so it's a bit hard to say how that last stage would have looked like, but we were meant to do like a Viva presentation and everything as well. Yeah.
All right, nice, nice. I wish Sheffield also had the osteopathy, or maybe they did and we didn't know about it, but it would have saved me at least a lot of time and pain.
I'm sure there was an osteopath
Yeah,
somewhere. You probably were just not aware of
yeah,
anything.
yeah.
Yeah.
Probably, probably.
Yeah.
So now, as I said, you're working as an osteopath, and so I know it's a very cliche question, but what is like a daily life of an osteopath look like?
Um, it's like every, no, I can't say it's like every other job actually. I retract that. It is very interesting. I love every day because every day is different. Every patient I see is different. So pretty much it is going to the clinic I work at, and then I'm booked back to back patients. Then I've got generally a break and then another few patients, then I come home. So that's overall, that's the gist of it. But each patient I see is quite different. Like they all might come in with lower back pain, but because their scenarios are very different, it always keeps you on your toes thinking like, okay, what does this patient need next? Or how can I change this? But they're not only lower back, like for example, today I was in work this morning and I saw someone with headaches. I've seen someone with lower back pain. I I treat pediatrics as well. So I saw a baby in that today as well. I saw a lot of people for maintenance, about 5 patients for maintenance patients. So these are patients who are coming in just like once a month as an MOT for their body. It's more looking at prevention rather than dealing with pain or injury. So they've been through all of it before, and then now they're just preventing this pain from coming back. And who else do I have? I had one patient who's had a surgery and has got rods in his spine when he was quite young. So we're just working to keep the rest of his body moving quite well. So it does vary. It every day is a different day into a life.
Do
Yeah.
you deal with any acupuncture regarding the face or like the eyes?
I don't, but I've had it done to myself because I work in a multidisciplinary clinic. So we've got lots of different people working within the clinic. One of them is an acupuncturist. So I personally have acupuncture for my head and face with her, but I've not dealt with it myself. I'm in the process of learning dry needling at some point.
Yeah. And then also you mentioned at the beginning, you said someone came in with the headaches. Is that what you said?
The the baby did
As
come
in
in with
you
the
no,
headache.
as in you said like you're listing your patients, and you said someone came in with a headache, right?
Yeah, yes.
And so, like, what does osteopathy do for a headache? As in, I assumed you just take a Panadol.
That's the easy way out. I think most people
Okay.
try and do that. Take
Okay.
painkillers, but you have got to realize painkillers are just masking the pain. Obviously,
Uh,
if we're talking about just the odd headache that you've had because of lack of drinking water or you're stressed out, that's a different situation. But these are people who experience headaches on a regular basis or every day. I've seen a few patients recently who've had headaches continuously for 2 years, like not a day
oh
without a
wow.
headache.
Oh my
Um,
god. Wow.
yeah, so headaches are classified into so many different kinds. I've actually specialized into headaches, so that's why I do see a huge proportion of them. But usually it could be coming from the neck, coming all the way up. So any tightness in the neck is what then leads to pressure, um, giving a sensation of headache. Sometimes it could be the jaw, like people clenching their jaw. and that's what can give headaches as well. So when someone comes in, the idea is to release all the tension in the muscles, release the joints. If it's their jaw, release their jaw. And we do a bit of cranial osteopathy, which is, it's a different field within osteopathy. It's a specialization. It's a little bit of a gentle technique where we're using just some light pressure to change the rhythm within what the cranial bones are moving. And that's how you release some of the pressure in the head as well.
It's an interesting question Rajat asked, and I'm also quite intrigued with the answer because just a month ago I went to see an Ayurvedic specialist, so herbal doctor for those who don't know what that means, and she applied the same principle and explanation as well as you did because of loosening the muscles around the neck, and then around my eyes, and realizing the pressure in the, well, one set of one part of the eye was much higher, and that leading to possible
Mm-hmm.
slight headaches later on. So like the way Rajat said, take a Panadol, but then she even told me that is a suppressant, like what you said. It's not going to solve the the pressure, underlying pressure problem.
Yes, and we get that a lot. People are just popping pills because it's more convenient. You don't have to take time off work. You don't have to rest. It's just easy to take a painkiller and then get on with the rest of your day. But if you keep having them on a regular basis, then I think you need to identify why it's coming on, what's happening with it.
Oh wow, that sounds interesting. I didn't realize there was so much behind headaches, to be honest.
I
Uh,
think there's so much
yes.
behind every joint and muscle in your body.
Well,
But even I'm learning. There's every day is a learning day. So I think there's a
mhm.
lot out there that if I would suggest, if you're suffering with something, try and speak to a healthcare professional. Don't just, I think it's quite common, we're all like, oh, I'll get better in a few days or I'll be fine. But that's when later on you start to see these problems developing at a more severe rate.
So in a previous discussion, again with the pressure buildup, I was told like it does even sometimes possibly lead to eye cataracts and even blindness
Mm-hmm.
later on if the pressure buildup is too extreme around the face area. So exactly what you're saying, go and see if the problem persists.
Yeah, yeah. She's quite right in that.
And another thing that's actually quite interesting, you said you work a lot with babies as well.
Yes,
So
yes.
how is that?
So I specialized into pregnancy and pediatric care as well, and it's a very growing part of my clinic life where I see numerous amounts of babies at the moment. I get messages from people all around asking for what they can do and everything. Um, so obviously, I don't know how much you guys know about pregnancy, but it's quite traumatic for the mum itself, like their body wise. But then equally for the baby, it's quite traumatic as well. They're having to go through a lot of force in order for them to be delivered.
Sorry. Are you talking about unborn babies or
Unborn to
born?
be born. Like, so
Okay.
I treat babies who are born, but I treat like mums whilst they're pregnant, and then I treat the mums after they've delivered, and
Right.
I also treat their babies after they've been born as well.
But just sorry, just to interrupt again. What treatment sometimes do babies need? And again, in your profession, that's a big
Yes.
question mark. I in my head.
Yeah, so again, you're not the only one, and this is what we're trying to raise awareness for. So babies, like I was saying, it's quite traumatic for them to go through labor, and sometimes they can get stuck in there. Sometimes they've been stuck for too long as well, so they can have restrictions in their neck. We don't necessarily go and crack their neck, or we don't go and move things like the way we would for adults, but problems like that can then lead to them being unsettled, not liking to be put down, flat down, not liking to be in a car seat. Sometimes they can struggle with reflux, which is every time they're having milk, then they start bringing it up. They struggle with head shape problems. So I don't know if you've ever seen photos of babies with flat heads on one side or flat at the back. So they can
Yeah.
suffer with things like that. They can suffer with colic, but the most common one is feeding difficulties. So they struggle to feed. If they've got like a tongue tie or if their neck is quite tight, then their jaw movements are not good. So then they struggle to feed, which is painful for the mom, but it's also painful for the baby as well. So those are some of the
Okay.
conditions we treat babies for. And it's very gentle. It goes back to earlier, like I said, I do cranial osteopathy. So that's what we use on babies, and it's very gentle. The pressure we use is what we can all tolerate on like our eyeball or what you're testing fruit at the supermarket with, like very gentle pressure. And we try to get things moving. Yeah.
Okay. And so how long a process is that? Is that something that you do over a couple of weeks, months, or is it quite a quick fix?
Again, it's down to it's a subjective situation. Every baby is different. Some respond within 1 or 2 sessions. Some respond over 6 to 8 sessions, weekly sessions probably. Um, but yeah, usually I'd say between 6 to 8, most babies tend to respond quite well, in my opinion. And then they come in for just regular checkups. So once a month for the first year or so. Some come in every 6 weeks, and they just carry on care till they see suitable. Because they're growing, then they start achieving like their milestones, which is rolling over. They start crawling, they start walking. So the idea is to achieve all of this at the right time for them as well.
Okay. And so, like, for example, you mentioned a common issue is the feeding part of
Yes.
it. And so, what's exactly the problem within the body, and what exactly are you doing to solve it?
Yeah, so when it comes to feeding, it's usually one of the reasons is their tongue. So I don't know if you've heard of tongue ties, where their tongue is
Yeah.
not lifting as high. So what we do is we try and stretch out that muscle tissue. So we try and get their tongue to lift up, but also start moving in both directions. So it's all just applying pressure and working continuously to help it to move up. It's the same way like you go for a massage. You go for a massage to ease the tension in the muscle. So that's the same thing we're trying to do under the tongue. And then we work with the jaw, because if the jaw is pushed back or anything, when they were born, if it gets stuck in a certain way, so we try and release it to bring it back sort of a bit forward so that their latch is stronger. And that's usually the reason why they'd struggle for feeding, if they're not latching quite well onto a bottle or anything.
Okay. And I mean, do you get, I mean, maybe not now, but did you get scared at the beginning when you were dealing with babies in terms of like how much pressure to put, and like when things are very delicate, right?
Yeah, so I wouldn't say the pressure to put, but it was when they're so tiny, like how to carry them
Uh,
and move them around. Yeah, I was quite scared when I started, but now I can move babies around, and like even parents are thinking, how is she just moving them around? But I don't feel scared now. But initially, I think it's because they're so tiny. You don't know what's so fragile, like what's going to bend or not bend. But I think what helped was me treating my nephew, who was about 5 days old when I put my hands on him and I started treating him. And because he's your own, you're not too concerned. Like obviously when you're working with someone. Because I mean, I don't think I could have harmed him in any way, and I don't think anyone would tell me off. Whereas if you're working with someone else's child, there's obviously that added pressure that you need to be careful. But the more and more I've seen babies, I'm now so used to dealing with babies that it doesn't scare me. So
Right.
yeah.
Nice, nice. And then so just on that, because I assume because you treat so many patients, I assume you come across so many different types of people on a daily basis.
Yeah.
And so just what's that like? Just meeting so many different type of people who do so many different types of things.
I mean,
Is it any also is it frustrating at sometimes? I'm sure it might get some frustrations with some angry customers.
Hmm.
yes, obviously I've got to be careful what I say on here.
Oh yeah, yeah, fair enough. Yeah.
There's always like in every working life, there's always people you come across that you don't necessarily want to work with. Some can be quite angry and rude, and I think that's when we step in and we say, uh, or personally, I don't accept any rude behavior from anyone because it's not fair. Like I'm only there trying to help. But our clinic is quite good as well. They step in for us as well. But yeah, you do meet very interesting characters. Meet interesting people. I mean, I can definitely say having a good network like this is what's helped us with our house. Like we've been able to do a lot of things in the house because of the people I met through my work. Um, it can get a bit overwhelming when you have to remember people's life stories over the day, and then it's like a refresh the next day. Because every time they come in, you try and be a bit more personal. So you talk to them about stuff that you know, aside from just their pain, so how their kids are doing or how their dog's doing, you know. So it can get a bit overwhelming, and sometimes I forget people's names, so I pretend like it's okay, and I just carry on the conversation. Like not the patient's names, their family members' names and stuff like that. Then you just carry on the conversation and hope they don't mention anything like that. So yeah.
Yeah. Have you ever
Okay.
got someone's name wrong? It's like you're asking the guy how's his wife, and then you say the wrong name, and then he's
Yeah.
like,
We-
Who is
yeah,
the
quite
who is the affair with?
"Who's
What's all
this?"
going on?
quite a few times actually. But then I just cover myself up. I'm like, oh, sorry, I don't know where I got this name from. I'm
Oh.
confusing them with someone else. But yeah, in the moment you want to be like, oh, can the ground just swallow me here?
So you do end up doing a little bit of psychiatry as well with your patients, right? Because I guess the injury and the mental health do go sometimes hand in hand.
Yes, so we follow like a biopsychosocial model, which is obviously biologically the pain that they're in, like structurally, but psychosocially as well, like what goes through their mind, how their surrounding factors affect them as well. And that's what determines the treatment plans we do. So you are right to a certain degree, but obviously we don't give therapy advice because I'm not licensed or qualified to do that. But generally, we are like a listening board to everyone, like we're just constantly
Wait,
listening.
sorry, just to interrupt there 1 second. So you said that not you determine a patient's recovery plan not fully based on their physical condition, but also based on the mental condition.
Yeah, you have to account for it. Because if there's a patient in front of me who's nervous to go to the gym, but then I'm telling them you need to go and strengthen your quad muscles or your hamstrings, you need to go to the gym. It doesn't work like that because then I'm stressing them out even more and they're not going to do what I want them to do. And then that's going to be an even difficult problem to solve after. So you do have to account for it. Sometimes they could be going through stresses at home, like family life, I don't know, stress from work, which could be a factor, but then also the injury they're in is because of work. So you have got to factor all these different things into it before you just set them a treatment plan. Some people might take longer to recover because there's a mental element in it as well. And some people will recover quicker because they're motivated, they want to get better, and they can get better as well. They can push themselves that extra little bit.
Another thing I want to ask is, I guess, what's the craziest issue that you actually had to come across?
Someone came in with numbness in their little finger, just numbness,
Okay.
wasn't stopping them from doing anything, no pain, but just because they had little like sensation gone, they were like, oh, I want to go and get that checked out. So that was, I think, one of the craziest ones because I was thinking, oh my God, what do I do with this? Like, I couldn't reproduce any symptoms, I couldn't do anything. And when I was pressing it, they could feel everything. So I was thinking, oh my God, how am I gonna solve this one? But
Wait, so what did you do eventually?
So, when it comes to nerves, your brain sits inside your skull. It communicates with every single cell in your body through your spinal cord. Now, the nerves that come out of your neck will supply head, neck, shoulder, down into your fingertips. The ones from your mid back supply around your rib cage, and then the ones from your lower back, they go down into your toes as well. So my idea was, what nerve supplies this little finger? How can I track my way up to the neck? And that's all we did. I released the neck, I released anywhere that nerve could be getting trapped, and kept working with that. And I still do see him, and he's about 85% better. He's got most of his feeling back, which was a win for
Wait.
me.
Oh, wait. For the little finger, like you're still treating him for the little. Oh,
Yeah,
wow.
still treating him for the
I
little
mean,
finger,
interesting.
and we've got about 85%
You
of his
know,
feeling back.
let me also ask you, with some patients, people even I've met before, where they've lost sensation, for example, in the foot or different parts of the body for many years, and I don't know the reason. Maybe it's a nerve problem. I just don't know. But then, is there chances and possibilities through such treatments for them to regain the sensation of feeling touch in the nerves?
Yes, and no, it depends why they've lost the feeling. Like if it's a sort of physiological condition, like potentially diabetes or anything like that, then maybe not as much. But if it is just purely because their nerves got irritated, then the chances are there is a possibility they can get most of their feeling back, or some of it at least. Yeah,
Right.
yeah.
Yeah, nice, nice. And I also have another question about what you, I guess, want to pursue later on. Because I mean, you don't have to answer this if you don't want to. But would you like to start something of yourself in the future, like a private clinic or
Yes.
something?
Yeah, so absolutely. So that is the plan. It's always been my plan that I want to move back to Kenya and open a clinic over there. Um, and again, to treat patients. But I think the bigger picture is, the uh, organization I mentioned that what introduced me to osteopathy. So I actually want to either work with them and make it bigger or open my own where I want to provide free treatment to rural areas, people who can't afford it. So that's my bigger picture. That's what I want to do is actually just provide free treatment to a lot of people who can't afford it. Because again, if I've got this skill, I want to be able to pass it on to as many people as I can. So yeah, I do want to open my clinic, but I think I also want to focus a lot more of my energy into opening either NGO or working with the current organizations in Kenya. Which is also it's a fact that all my clinics here and every job I've taken, I've been open with them that I want to move back at some point and I want to open my own clinic. So yeah,
Okay, that's
sorry, you
good.
were saying
That's good.
something.
And because yeah, just to no, because just to follow up on what you said, because I know I feel like maybe osteopathy isn't as big as maybe some other disciplines, or maybe that's just my ignorance. But is it just geography? Is it just based on geography? Is it bigger in some regions compared to others, or is it more of a global thing?
As I would say in the Western world, it's more of a known
Hmm.
profession. Like here, if you go and speak to anyone, they will know what osteopathy or chiropractic science is because they're very similar fields. So a lot of people will know, like if they've got any injuries or anything, they will know who to go to. But if you go back to Kenya, like not many people knew about it. Definitely not 8 years ago, but now more and more people are knowing about it because whenever I go back home and someone asks me, "Oh, what are you doing?" and I always say, and they're like, "Oh yes, I took my baby to an osteopath," or I've had osteopathic treatment. So it is becoming more known, but I think the Western world is definitely higher than the developing countries still.
Yeah, great. And also because you mentioned chiropractic, is that the word?
Chiropractic sciences, yeah.
Yeah, chiropractics, yes. Because you've also done, I know about Rishi, but you've done a couple of cracks on my body, which have helped quite a bit. So is that part of your learning as well?
Yeah, so what I've done, like the manipulations that give the cracking noise, that is a technique that both osteopaths and chiropractors learn. I think people resonate it with more chiropractors than osteopaths, but in reality, we all learn these techniques and we all use them according to what the patient needs. Like you said, I've done it on you, I've done it on a couple of our friends as well. I don't think
Mhm.
I've ever done it on Rishi yet. Rishi's always just been, I've injured something. What can I do to make it better? Yeah.
Nice, nice. Cool. And then I have like one final question as well. Do you have any just general advice for us, the listeners, on how we can improve our day-to-day life in terms of general, things like posture, sleeping, sitting, etc.?
So I was actually waiting for you to ask this one. If you hadn't, I was going to slip
Great.
it in at the end.
Okay, great.
I think the one
we,
thing
we we run a very professional ship over here, right? We
Hmm.
ask all the right questions. So
I think you do. You do get credit for
uh,
that. So the one thing I definitely say, and I wish someone had told me sooner, is movement. Like, no matter what you're doing, you need to get moving. Whether it's being sat at a desk, like you want to get up every 30, 40 minutes, even if it's just going to get water or tea, or even just doing a small dance and then sitting back down, you need to move. Whether you're I don't know, lifting weights or you're working in a job that's more manual, you still want to move, but in the right way. Like you want to stretch your body out. You want to go and get a leisure walk for 20 minutes in your day routine. So yeah, I think movement is medicine is what we say. So if anyone wants to avoid things, they definitely need to start moving a bit better.
But also, like for example, with the desk job where someone is sitting, I say accounting job, someone's sitting for very long, and then their immediate solution is to have a standing desk or stand up for a certain period of time. Is that really helping that much or not? Because I feel like if I'm just going to be standing somewhere, I get very tired. I feel my everything just starting to hurt, like after a long time. But I don't see much help going on to from
So,
sitting to standing, and just only that.
so see, that's where what you've just said. If you stand for a long period, then you get tired. But that's the thing, like I was saying earlier, what bad posture is being in a position for too long. So a sit to stand desk is a good one because you can sit for a bit and then you can stand for a bit. Then you sit down for a bit again, you can stand. And as you're standing, don't forget you're shifting your weight from side to side. Whereas when we're slouching, we get into bad practices of like slipping down, slouching a bit more, and then being fixed in that position. So that's where the stand-up desks do come in handy. But if you're just going to stand for 8 hours a day, then that's not good for you either, because then your muscles are going to get tired from just holding you upright.
Right.
Yeah.
Uh, then any question, Arjun?
No,
Okay.
I don't have
So
any question.
I wanted to ask you. I don't know. It's a very vague question to be honest, but the relation between your profession and exercise physiology, is
So
there much relation or basis to that?
there is to a certain degree because we are dealing with rehab, we are dealing with getting people to do exercises and everything. So there is, but you would have to study more into it and people would have to specialize and do a bit more research into it. It's not every osteopath you see wouldn't directly relate that to exercise physiology. So there is a link, but it would have to be a very specialized link. So I've done a bit of research into it, so I can say yes, there is, but I'd still need to do more and more work into it to actually understand the basis of it and how I can apply it to my own field of work.
In your how do you say case study, um, what type of research into exercise physiology? Because you talk about the cells, genes, I don't know, bone structure, everything. But in your sense of research,
What do you mean? Like,
what are you researching into in exercise physiology?
so a bit more into the cells and the bone side of things, because obviously genetics, we can't control that as much. I don't think anyone can control genetics as such. So we can't, yeah, I can't do much with genes, but when I look at it, I'm looking at more cell structure and I'm looking at, because cells obviously make up everything in your body. So we're looking at how that can improve and how bone health can also be improved with it.
Okay, nice. That's
Yeah.
good. That's good.
But I would have to do
Yeah.
more research. If we have to have another conversation on it, I'd probably have to do more research into something like that to have a full
Are
conversation.
you are you
It
are
is
you
it is a very interesting topic. It's a massive topic, so maybe that's another one for another
are you
day.
saying a
But
PhD
yeah.
is on the cards, Rinal? Is that what you're
No,
saying?
I think I'm
Yeah.
Yeah.
See.
studying. I don't think I could do any more. I mean, to be fair, I do have to study. Every year I have to do about 30 hours of learning. So I do study quite a lot,
Uh,
but nah, I couldn't do a full university degree again. Yeah.
I think
Anything
uh, I think none
anything
of
else?
us could go through that again. I think it was a very
Hey, we
You're
can
some.
head over to our fun area.
Oh, great. Okay.
yes. Carry on. Take it away, Rishi.
uh, some rapid, funny, fun questions.
I'll be
Funny.
honest, I'm not very good with on the spot questions, so we'll see how this is gonna go.
It's just random. It's nice. All
It's
right,
fine.
let's
Most of
start
the
off
people
fun
who
with
have
the.
come on haven't been that good, so it's
That's very true.
okay.
For those who have been on, kindly, we'll love to have you again on the show.
Yeah, please.
But let's go. Question number one. A nice, simple, easy question. What is your favorite breakfast to have?
My favorite breakfast actually is just Weetabix, but it's more down to
Oh
that's
wow.
what I have. It's more that's what I have on an everyday basis, just to keep me full and stuff. But I think if I were to actually go, my favorite would be like pancakes. I absolutely devour. pancakes.
What's your topping? Pancake topping?
Just lemon and
More
sugar.
pancakes.
Oh yeah, lemon and sugar is a classic
Wait, lemon and sugar.
combination. I must say,
Yeah,
very
lemon and
very good.
sugar.
Lemon and sugar. Yeah, really good.
It's like sweet
Yeah, I'll
and
stick to
sour
my
at the
chocolate
same
sauce and
time. It's
Nutella.
such a good combination.
Yeah.
Yeah, it's okay. It's okay. I'll not keep my thoughts to myself. Yeah. All right, a little bit of a deeper one. What quote resonates with you?
You only live once, if I'm thinking at the top of my head, like make every moment count. So yeah, and I do follow it. I think yeah, you only live once, so try and do as much as you can. Try not have any regrets in life, and just enjoy. You can't control everything, so just do what you can.
Nice.
Yeah.
All
Nice.
right, question number three, something completely different. What stranger do you still think about sometimes? Now, that could be like having met someone and was a very interesting person, uh, not in a
Wow.
relationship way at all.
Wow.
Could be, I don't know. But yeah, which random person made you, just be like very interesting, and you remember that since?
So I was actually on a flight from Kenya to coming back to the UK when I was studying in university, and I was traveling on my own. And there's this random Asian man who came and sat next to me. You know when when you're boarding, but you're still sat at the gate. So I don't know what he saw, but he came and sat next to me, and he was telling me these interesting stories about how he was on his 12th passport. Give or take, the man looked like he was in his 50s. Yeah, it looked like he was in his 50s. 12 passports as in of the same country, but like 12 renewal passports because of
Oh, okay, okay.
how full they were. And he'd said like he'd traveled so many places and how he'd given jobs to all these different people. And till date, I wonder how can someone have traveled that much that they filled 12 passports like that? Yeah, so I would say he was probably the most strange but interesting person I've met, and I still think like maybe I want to get to that stage. I'm on my fourth passport, so maybe I want to get there.
Then we'll have someone else on this podcast being like, I met a lady, Rinal, who had 13 passports traveling. Uh,
If you find that Asian man, maybe you can ask him to come on the podcast. We'd love to talk to him.
Okay.
and find out where he's been
Yeah.
going and what he's
Yeah.
been doing.
If
It's a very
I've
serious
I
question.
haven't in all my travels, I haven't found him again.
Uh,
So
All right, the next
yeah.
question, or question number four, I think we're at. So, what is a lesson that took you a very long time to learn?
Oh wow. Um, this is gonna be a bit of a deep one, I think. I mean, I think the question is deep, but I think I used to think a lot about what people thought of me. So how I would behave in front of people, what I would say, all of that I would think 10 times before I'd do something because there was always that thing behind that people are going to judge me for it. And then I went through a phase in school where people anyways judged me and I wasn't even in the wrong. I was just being myself. I'm not going to go into too much detail. But after that, it took me a while to, get over it. And now I'm a bit like, who cares what people think? If they have a problem with me, they'll go and deal with it on their own. Like, it doesn't affect me as much as it did. And I think it was just this one phase in school that I went through. And I was like, enough is enough because I don't want to be miserable. So I've stopped thinking about what people care.
nice.
Nice,
That's really good.
really nice. Yeah.
Or I try to.
Now again to the upside, an upside question again. I've taken you on a roller coaster with the questions here.
I,
On to the second last question. What is your favorite holiday place destination and why?
so I've traveled quite a bit, so that's a hard one to pick. I think I'd want to pick quite a few different places, but I would say Greek islands. That was my favorite holiday. We did Santorini and Mykonos. Maybe not those two islands, but just in general, the vibe on a Greek island seems quite nice and chill. They're obviously busy during the tourist period, and then they all relax for the rest of their time. But the water, I love being around the water. So the blue clear waters was the best thing. And then what we did was we rented ATV bikes and went around the whole island for those 2 days that we were there. So I think that was it gave that sense of freedom. We could go and do whatever we wanted. We went beach hopping. So we used to go to a beach, park up, go chill there, go in the water, then get back on the bikes, go to another beach or another spot, do the same thing, get back. And we did that the whole day to the evening. And I think it was just nice because we were not tied down to anything. And people are so nice. Food is amazing there as well because it feels all fresh. I think when you're on holiday, everything feels quite fresh and nice. So yeah, I'd say Greek islands.
Hey, nice, nice. On to the final question of this lovely day, morning, evening, wherever you are. What is one book you'd recommend to read to all our viewers?
The Secret. I've forgotten who the author is. Oh my god, I've forgotten the author, but
It's a
the book.
secret, the author.
But no, The Power of the Secret is the name of the book. I think it was a really good book because it tells you how to channel positivity, and it's the law of attraction. You attract what you keep thinking about in the universe. So I think especially when you're young, reading a book like that really does change your perspective onto how you view things and what you want in life later on. So yeah.
Hey, nice, nice. And that brings an end to our rather lovely rapid fire questions. We did have some bloopers in between, but we shall not mention them. But for all our listeners in, Rinal does have a osteo Instagram page as well. Go and follow that, osteo underscore with. I don't need to spell that. Okay, WITH for those who have struggle. Underscore Rin, RIN. Yeah, go check out her page. She got some very
Thank
interesting
you.
things there, and I think all our listeners have found this very interesting. I mean, me and Rajat have found it interesting, and as she's told you, she's helped us through a few crisis physical points in the past few years.
Yeah, yeah.
But honestly, amazing work. I hope you really do achieve your dreams and the way you're planning you want to continue with your career. So I think that's it from me. Thank you for having yourself. Sorry, we thank you for being on the show. Oh my,
I was gonna say thank you
it's
for
been a
having
long day,
me.
but yes.
Uh,
But how
yeah.
about you, Raju?
Yeah, no, I completely echo everything that Rishi said, except the last part, which was a bit weird. Uh, but yeah, thanks Rinal for coming. Lots was learnt, I think, and obviously I think we take our bodies and all these things for granted, but it's really interesting to know some of the detail and some of the work that goes behind it. Um, and may you continue to treat our broken down bodies in the future. I hope.
You're
Amen.
always welcome.
Amen.
You might just have to travel to Chester for it, but sure, you're welcome.
That's fine. We'll do what it takes at this point.
But no, thank you for
um,
having me. I know it was a very brief discussion of what I do and everything. There's bits that we can go into details about, but it would take forever to do that. So thank you.
I
that's
mean, if
why we.
anyone, listeners wants to, has a topic they want to discuss regarding this Rinal's expertise, kindly do reach out as usual, and we can link you guys up.
Yeah. Yeah. I mean, also, I mean, we can always do a part two video as well. I mean, the reason maybe it was so short was because we didn't know enough to ask those questions. So if there's stuff that you want to discuss more of, then we can more than happy to do
Maybe
that
we'll
Yeah, we
do
in
can
part
do
two.
a video one
exhibit.
with
Yeah.
the live person or skeleton, up to
Yeah.
you,
Oh,
and
that's a
we
great
can
idea.
show all our viewers what's up.
uh,
Okay.
yes. But yeah, thank you again, Rinal, for joining. Thank you, everyone,
Thank
for listening. If you like the podcast, like, share, subscribe, and
Even if you didn't like it, like, share, and subscribe.
yes,
It's
exactly.
one job, takes two
Yes,
seconds. Do it.
exactly. Exactly. Yes. See you in the next episode. Bye bye.